why are we going to talk about foot and ankle and knee pain as a chiropractor? Well, we're going to make sure we go through that a little bit. Number one, we want to make sure you understand what does cause foot and knee pain, and we want to make sure we talk about some preventable and treatable options, ways to prevent and treat options for foot and knee pain, and you're going to do some little assessments on your own. Ultimately, your body is going to feel pain through your nervous system. So your brain is going to perceive pain through something called a noxious stimulus. Your nerves in your ankle and knees right now, we'll talk about those, and your feet, those nerve endings have nociceptors. Those receptors sense inflammation, irritation, or pressure, and they're going to send a signal to your brain that something is wrong, something is injured in that area. Your brain has the opportunity to decide if it will actually let you consciously know about the signal or not. So your brain has a filter. It's called the reticular formation. And in that part of the brain, your brain has to determine what signals are the most important to respond to or are basically the most intense. If it's a very intense and strong signal, the brain will probably be aware of it. If your ankle had a strain in it, and maybe it was a chronic strain that had some little bit of inflammation, it may not make it to your brain until it gets to a certain point of inflammation in which your brain goes, ooh, you know what? It's time to take care of that ankle. I think it's obvious in a traumatic situation that those signals are so strong they come right back up to the brain. If I broke my ankle or rolled it really strong immediately, I think my brain's going to know about it. But if it was just a chronic arthritis building up, you don't know about that arthritis for probably 20 years. You could be developing arthritis in your feet, your ankles, your knees for 20 years before you know there's a problem. So one of the biggest things that you should be aware of in understanding about your body is that your body does a really good job of adapting. Your body was not built to be healthy. It was built to survive. So when our bodies respond to signals or stressors, it's responding to keep you alive. It's not necessarily responding so that you don't have arthritis or all the chronic diseases that happen to us. You know, we learned in school the first symptom of a heart attack is death. It can be. You may have no signals that it's going to happen because your body is doing what it's supposed to do to try to keep you alive. So when it comes and bring this back from the morbid institute of death, we're going to talk about your feet and your knees and your body and how do these things start to develop problems and how is it perceived? Well, number one, know that pain is perceived. So some people are more sensitive to pain than others. Pain is perceived. Number two is that there's a lot of things that can be going wrong in our mechanics before we develop a problem. So this is why, as a chiropractor, we want to look at your structure and your gait and your movement and your joint function, because if your joints aren't working well, if there's restricted, that can cause pain. If you have improper footwear, improper stress on your body, it's going to start to show up. People, if you have big bunions, especially more on one side, that's because your body has stress constantly on one side because your body's unequal. But what do we medically do? We just cut them off. We don't look at why would they be developing. What do we need to do to change the mechanics of the feet? How do we improve the body's mechanics? Because foot and knee pain is going to come from two areas. Number one, it could be coming from your arches. Your feet could have improper arches, and it could try to transfer upwards. So like your problem comes from the ground up, or it could come from the pelvis down. So if our pelvis is twisted and distorted and we're holding our body in a distorted pattern, we're absolutely going to have a distorted amount of pressure on one side of our body. So chronic old injuries and accidents can distort us. And so you can have problems in your legs and feet from your pelvis, and you can have them from your feet and ankles and your arches. So we're going to get into that a little bit. So I love this picture because this picture, it just shows how we're a mechanical chain. We are a chain. If your ankle is rolled in, if you have a dropped arch or a loss of arch, you have 3 arches in your foot actually. Most people just think you have that medial arch, that inner one that should be high off the ground. But you actually have an arch on your foot that goes across the ball of your foot. We call the metatarsal arch. So you've got your medial arch, you've got one across the ball of the foot, and then on the lateral aspect you should have an arch too. So you have 3 arch system. It kind of makes a triangle. If any of those are dropped, your foot can roll in, just like you guys are seeing on that screen. If the foot rolls in, so does the knee. It rotates together. So it actually jams into the inner part of the knee, which is where most people's arthritis start in the knee, is the inner part of of the knee, the medial aspect, the inner part. And then that strains the tendons and we jam into these other parts. So most people will develop knee issues because of ankle pronation, we call that. If the ankle is pronating, the hips dip. So now we've got hip development, or it could again go downward where our hips dip and that pushes our leg and our ankle in. I have so many patients who come in my office and we're looking at them, their pelvis is very unlevel, and I can tell that one leg truly didn't develop as long as the other. It's truly a short leg. And so now their body is almost attempting to make itself level. Again, it's trying to survive. It's trying to take stress off of you. So to do that, I see people who when they're standing, if their hips or if their legs are different length, they might bend one knee. They might actually stand more in front to kind of like lengthen or shorten that leg. I'll see the foot really roll in like this, but that foot wasn't necessarily the problem. It was actually the whole leg was short, or too long, I should say. And so the body's trying to squish it so it becomes level. All these things start to develop foot and ankle and knee issues. Remember this too, your body follows your head. And if you look at your x-rays for a majority of you, you'll see that your head is forward of your shoulders. And so if I'm worried about trying to keep equal weight on my feet and my head's coming forward, I'm now pushing the weight balance on my feet. So our bodies are connected. They're totally tied together. We call this the kinetic chain. And this is just showing the bones. So if you're a static person and all you did was stand, we could improve your arch and hopefully that would balance you right out. But you also move, which means all the muscles and ligaments and tendons are all being affected by this kinetic chain, and they could go over under something called creep and hysteresis. Weird words, but all that means is that they'll shrink or tighten and shorten. If you don't use it, you what? You lose it. If my feet were built to handle the changes in a ground, like if I never had shoes in life and all I did was live in the grass, my feet would be being challenged and stimulated all the time. Different terrains, different surfaces. They would have to work, right? A lot harder than if I just stood on hard concrete. But most of us are gonna put on what? Shoes. I mean, they have the cutest shoes for kids. Little kids, like the cutest things. But you know what? You're taking away what we call the proprioception, or the ability for the body to learn the ground, to challenge the arches, to develop arches. When we go into shoes, our shoes start to take over and we lose the arches because we're not using them. The shoe just makes it. And so a lot of these issues, by the time you're 7, you will develop your gait and pattern. But it takes that long, actually. If you've been in shoes for a long time, you've never really played around in your bare feet on the grass, if you had any injuries or accidents or had any birth defects where your feet didn't develop right, all these things can challenge that gait and long-term affect your ankles and your knees. And very few of us are really stretching and manipulating, which we're going to get into, our feet. Even if we're stretching out, a lot of times we're not stretching our feet. We're stretching our calves maybe, or our legs, but not our feet. But ultimately, if we can balance you out, proper relief of pain is going to deal with proper support from the arches and the hips. What preventative treatment or measures do you plan to try is what we kind of want to go through here. But what pain you're experiencing is going to kind of affect what treatments you try. So we're going to kind of dig into a little bit of these things here. What I want to do is start to kind of go over a couple of the treatment things that I want to talk about. Number one would definitely be that if you are a patient, and almost every patient at this point should have been scanned with our foot analysis machine. Our foot scanner is going to let you know if the arches are dropped. If they're dropped in any way, we can custom create orthotics to help bring some of that into balance. The orthotics are going to look like these things. I don't know if you can see, but you guys might see there's a big bump. There's a bump here. That's that metatarsal arch, a lateral arch there, and then the medial. Those all need to be supported, and when they are, people stabilize much better. So orthotics, those are a big, important thing when you have foot and ankle issues, because we need to start to stimulate, just like I said, underneath our feet, like we're walking on the ground. So these aren't going to force you up, but they're going to prevent you from going too low, but they're going to also stimulate the little muscles in the bottom of your foot and give them like a constant massage when you're wearing them. So to try to prevent some of these things or correct some of the issues people have with plantar fasciitis, with even knee and hip problems, arthritis, can all be somewhat helped by leveling out the system, just like the green guy that we're looking at. So orthotics would be one of those things. The other thing would be that you might have a short leg, and if you're in my office or you haven't been assessed for that short leg, you can always ask me. All your files have a note if I see it on an x-ray. Because if your leg isn't the same length, it's going to be a constant challenge. It's pretty simple. I don't have it in here, but it's a little rubber lift we would just put in underneath in your shoe. And that would help to balance you out a little bit. What we've seen naturally that can help with the feet is making sure that we're doing a lot of foot mobility. We call them mobilizations in your foot daily, and calf stretching. That's probably the two biggest that I've seen are necessary. So one of the simplest exercises I would tell everyone one to start with is I would say if my hand was your foot and you put your foot kind of up on your big toe, you would try to roll and you go clockwise and counterclockwise around your big toe. What that should do is kind of move all the joints in your foot. Your foot has a ton of bones in it and you need to move them all. You would try to make as big of a circle around your big toe as possible. It may hurt. You might have some arthritis in there, so you go very gentle, but mobility is key. So you have arthritis and you don't try to move it more, the body's going to get stiffer and stiffer. And if you remember anything from some of my workshops, if your spine gets restricted, we call that a subluxation. You can have subluxations in your feet. Those bones can be out of alignment and restricted. So when we adjust them and get mobility back, it will help function and take away pain. But one way you can do it is by just counterclockwise and counterclockwise rolling right around your big toe. Make as big a circle as you can. The second thing would be is stretching the calf muscles out. Well, I would say almost everyone has tightness in their calf. So if my forearm here is like my calf and this is my foot, what we would tell you to do is, if you've been on our vibes, that's one thing, but if you haven't, we would tell you to put your toes on a stair and let your heel drop below that stair. Keeping your knee very straight, you would just drop down and you would do that so that you're getting a good stretch. What I would also tell you to do is then bend your knee slightly, because that will actually stretch your Achilles tendon more than just your calf muscle. But when we stand, or even if we sit all day, those muscles get tight and they are then restricting the motion throughout your whole body. Those are some of the simplest things for mobility exercises. Now remember, I can adjust feet, I can adjust knees, I can adjust hips. So not only is the spine can get adjusted, so can the feet, hands and wrists as well. So we can realign and mobilize those, and those get those joints moving again. That's kind of the next most important thing. A foam roller is also very beneficial. You do have to be able to get down on the ground to use it usually, but a foam roller is also very beneficial. The foam roller can be used as a self-massage tool. I'm just going to use my hand as my foot again. So this is like my calf right here, my forearm. But you would just roll, you put this on the ground and you would just roll back and forth on your calf. It's like a self-massage, back and forth. And you could do even other parts of your shin. But a big thing is rolling your calf out. You can even roll your knee out. We'll come out with videos eventually, but if you had one of these at home, you could YouTube very easily just get exercises sent to you on your computer, and it will teach you how to use a foam roller for knee pain, for ankle pain, and it could help to loosen that up. This is going to work out the fascia. The fascia is a covering on the muscles that gets tight and restricted when we haven't stretched. So we want to break it up. Like on a steak, it's that white or grayish portion of the steak that's just impossible to digest sometimes or chew. That's all your muscles have that, and you want to break that up, that fascia. So using a foam roller to break that up would be probably my number 2 thing to go through. A massage therapist would be good if you can't say, hey, I can't seem to do this on my own. Massage therapist would be really good to get into the areas that you are not able to on your feet and calves and ankles. But it does need to strengthen as well. So one of the simplest exercises, so other than the mobilization and stretching, the last thing you need to do is get it stronger. And one of the simplest ways to strengthen your ankle, knee, and hip, and kind of your whole posture at one time, if you're going to do one exercise, is balance. Balance is one of the best ways to do that. So you just go up on one leg. You're just standing on one leg. If you can't balance well, you're going to have to hold on, but going on one leg for 30 seconds to a minute, just trying to hold that, because that forces your ankle to stabilize, it forces your knee to stay strong, and your posture. Make sure you're maintaining really good posture when you're doing that. But just one-legged stance, we call it one-legged stance. And if that gets really easy for you, then start to challenge yourself by looking around the room when you do it. Maybe close your eyes, but be careful. Now, if all that's really simple, then you'd want to stand on a surface, if you can do all that, that's softer. Rolling up a towel and standing on that. Even a carpet with like a big pad underneath it, it's actually more unstable than a hard surface. So that's ways to challenge your balance. We do a whole workshop on balance, but one-legged stance and balance on both legs is, to me, one of the best exercises to do. One other thing you could do is write the alphabet with your ankle. You ever seen that? You can kind of write it. You can even pick up a towel with your toes. That's another great exercise. That just strengthens. Like I said, I think one of the simplest things is just a one-legged balance. And if you're really unstable, you've got a wall there. Just make sure it's there. If you can start to not hold on the wall constantly and just tap it, that's one of the next kind of levels of that, is doing that. So there's a lot of ways to support your body. You may want to look into supplements that help reduce inflammation or help strengthen tendons and ligaments. We carry the collagen products here. Collagen is great. It helps a lot of the muscle, tendon, joint issues, trying to prevent breakdown, any more breakdown than there already is of the cartilage. That's what collagen is for. Turmeric is usually in a lot of products as well for inflammation. Fish oil can also be good for inflammation, but the collagen product that we carry here is very, very good to help a lot of tendon, muscle, and joint issues. So that's kind of what we'd prescribe that one or we call it NutriDisc. That's our turmeric product. Those are going to be for joints and tendons. That you may have injuries. You might have things that are going on in there that we can't undo. You have some arthritis and things that we can't undo the arthritis. But if we can reduce some of the stress on there, if we reduce the inflammation so it doesn't keep building up, that's what supplements are for. We don't want you to be stuck on Mobic or anti-inflammatories your whole life. If you don't have to be, there's natural ways to help with that. Okay. And there are definitely, more aggressive medical treatments when things get really severe, but we're here to try to help you prevent some of that stuff. All right. Have a good night, everybody. Bye-bye.